Hey y'all, it's just me, Eileen, and sitting here Saturday night, getting ready to go live here at 7 o'clock. Looks like I've got probably about an hour and a half or so left to go while I'm getting ready. While I'm getting ready, Piggy's outside doing his live, or not live, excuse me, doing a video for Piggy's Piddles. And I thought I would talk a little bit about some things I've kind of gone over on my own channel, but kind of go into depth about it, and I'll probably go into more depth later on. But in 2013, I was diagnosed with endometrial uterine cancer, and it was stage 3C. I had been having a lot of female problems and didn't really think anything about it. Had gone to the doctor and had a pap test, and it came back abnormal, so I had to go in and have a colposcopy done, and that came back with some really weird results, and I knew that the results that came back were wrong, so I figured, well, I'll wait and I'll go back to a doctor later, because the doctor I had gone to was just a little, basically government-run doctor, and I'm just going to say that I wouldn't suggest anybody go to them. I'm not going to say who it is, but I wouldn't suggest anybody go to them. And that was in April of 2013. And by June, it was probably middle of June, I wound up having to go to the emergency room. At that time, I was working at Subway as the manager, and I thought I had pulled a muscle on truck day in my right side, because I had excruciating pain in my right side when I got home from work that evening. It was a Thursday evening, and couldn't hardly sleep. I was in severe pain, and I took some OTC pain relievers and went to bed, and had to get up the next morning to go to work. And I thought, well, maybe it'll ease up, and it did a little bit. But when I got up that Friday morning to go to work, I was in so much pain, but I couldn't get a hold of anybody to come in and cover my shift so I could go to the emergency room. So I went ahead and went to work and did what I could do until I could get somebody to come in, and never could get a hold of anybody to come in. So the person that was scheduled to work with me finally got there, like at 9 o'clock that morning. So I'd been sitting there for over 3 hours in excruciating pain, working. And when they got there, I told them, I said, listen, I said, I have got to go to the emergency room. I said, I cannot work any longer. And left it with her, and she finally got somebody to come in a little early to help. But so I ended up going to the emergency room. They got me in. They did a did a CAT scan, because they put me through that machine. They did a CAT scan. And after they did the CAT scan and everything else, they come in and told me that they had a doctor going to come in and talk to me that was on call. It was the OBGYN that was on call, Dr. Woods, and that as soon as she could get there, because she was at her office, that she would be to talk with me. Well, we waited, I guess, about 30 minutes for her to get there, even though she's like right next door to the hospital. She came in and she told me that they had found a mass in my right side. I said, okay. And they said it was about an 18 centimeter mass. And not realizing what 18 centimeters was, it's roughly, I think, around 6 inches. But she told me that I would need to have surgery. And with all the female problems I was having at the time, that I really needed to have a hysterectomy. Now, she told me, she said, I can do your surgery, but with the mass and other things going on, she said, I would prefer to send you to a specialist. And it's not that I can't do the surgery. She said, I just prefer that you go to a specialist just in case it's more than what is the, what I'm thinking is there. And she asked me where I wanted to go, which would be easier on me, Atlanta or Chattanooga. Well, Atlanta is like an hour away. Chattanooga is only like 20 minutes away. And I told her, I said, well, if you could get someone in Chattanooga, that would work for us. And she got me set up with Dr. D at the tumor clinic in Chattanooga. He's no longer at the tumor clinic. He's with the hospital up there now. But at that time in 2013, he was with the tumor clinic. And that's a volunteer thing. Doctors that work with the tumor clinic are all volunteers. But I got in to see Dr. D in July. Normally, at that time, they were only seeing patients at the first of the month. And then they would schedule what they needed to, if they had to have surgery, whatever, after that. Well, this was around, I want to say, the 16th or so that I got in to see him. There was another lady that got in with at the same time. He made a special concession to see both of us out of normal hours for him there at the clinic. And we went in, and he talked with me and talked with Piggy. We were together as a couple at that time. We weren't married at that time, but we were together. And he wound up doing another colposcopy on me because we told him what had happened during my previous one and everything, and that I had gone into shock after it. The doctor and the nurses, none of them knew what was going on with me until Piggy told them. They had to go out to the vehicle and get him because I was asking for him. My blood pressure dropped down to 72/58, and they thought my blood sugar was down because I knew I was a diabetic, and they kept saying, have you eaten anything? Have you eaten anything? I'm like, yes, I've eaten something. So Dr. D, after hearing all of that about what had happened, decided to do his own colposcopy, and he knew that since I had gone into shock the first time, there was a possibility of me going into shock again. So he and the nurse, Carol, they took care of everything, and then, of course, I did go into shock, and Carol realized what was happening. She took care of me while Dr. D talked to Piggy, and it worked out. And they sent everything off to be tested, and he told me, he said, I'm not sure what's going to come out of this. He said, but you do need to have surgery. And he said, we're going to see about getting you set up for surgery. And I said, okay. And went over everything that needed to be done. And I told him, because he said, well, as we get in, we may have to take this out. And I told him, I said, listen, Dr. D, I said, whatever needs to come out, take it out. I said, if you think it needs to come out, take it out. I said, I'm not going to argue about it. I'm tired. I need something done. And they sent me up to get my blood work done on the 25th of July. And I went in on August the 1st to have my hysterectomy. And at the time of the hysterectomy, it was a complete hysterectomy. They cut me like 14 inches down my stomach. They took out my uterus, my fallopian tubes, my ovaries, the mass that was actually on my right ovary. They took out 2 lymph nodes, my appendix, my omentum. For those of you that don't know what an omentum is, it is the fatty layer that goes over your intestines to protect them. And it actually comes up to kind of right below your rib cage all the way down, and it protects all that area there. And but they took all of that out. That was on August the 1st, which was, I believe, which was a Thursday. And so I went in on Thursday the 1st, had my surgery. Didn't really eat anything until Sunday. I had gone 3 days before my surgery. I started the cleanse, which was a liquid diet, and the magnesium sulfate. That little magnesium bottle stuff, nasty. and you had to do the clear liquids and all that. And I did that for 3 days before my surgery. And I tried to, really couldn't eat anything the day after my surgery. So I had, was hooked up to the IVs and liquids and stuff. That little IV thing was my friend, y'all. And so I was in there from the 1st through the 9th. First, second, third. The 4th, which was Sunday, I tried to eat something. I got sick. Not when I say sick, I mean I was sick. Couldn't hold anything on my stomach. So they took me in early morning hours and did another CT scan on me and found out that had an obstructed ileus, or an ileus obstruct, whatever it's called. Anyway, it's where your stomach closes up, the base of your stomach closes up, and nothing goes from your stomach into the intestines, colons, and all that, and works its way down. Everything is it's obstructed. There's nothing there. No way for anything to get through. So if you put it in, it comes out one way. So they wound up putting an NG tube down my nose into my stomach. And that was early morning hours on a Monday, the 5th. And then on Tuesday, the 6th, my doctor, it was Dr. D that came in and talked to me that day. He told me that they had the pathology reports back on the biopsies they did off of everything. And he said that the mass that they removed with my right ovary was benign. However, my right ovary was malignant for cancer. My uterus was 19 of 28 centimeters in base of cancer, malignant. The left ovary and fallopian tubes, and both fallopian tubes were no ovary present. My appendix was great, fine, nothing there. The amentum, no cancer there. The lymph nodes they took out one on the left and one on the right in the groin area. The one on the right was benign, nothing there. The one on the left, 2 of the 5 biopsies they took came back malignant, so it was getting ready to enter into my lymph system. So, and I can count y'all, this whole time I've had nothing to eat, been basically on liquids from the IVs and things they've been giving me. And so I'm like, okay. And this was, like I said, on Tuesday, and I had been in and out of it from the time of my surgery. I just I was literally floating for days. But I let Piggy know what was going on. He had gone somewhere to help a family, one of his mom's family members. And she was there at the hospital with me at that time. And then when Piggy got back to the hospital, I told him what was going on, and told him that the doctor said that once I got out of the hospital and was able to set up an appointment, we would discuss what my options were as far as chemo and radiation and everything. So this was on Tuesday, and then I was in there for 3 more days. So then on Wednesday and on Thursday. Thursday was a turning point for me. I was lying in bed that night, and now taking account, I had gone all this time with nothing to eat, nothing to drink. And that Thursday, through this whole time, my thing was, I was out of it. For the first few days, I was on the pain pump, and every time I heard a noise, that little pain pump got cut on. Then they took me off that, and they put me on the oral dosage. Well, not the oral, it was the syringe, because they had to put it in my IV because I couldn't drink anything. But, so I kind of got weaned off of the pain meds. But that Thursday night, I was in bed, and I was kind of in and out, and I was kind of in a dream state. I mean, I had been praying and praying and praying, because that's all I had to do. I mean, it was just like turning everything over to God. And while I was in bed that night, I could see this darkness coming up the hallway of the hospital and into my bed, into my room. And the dark was so dark, and I knew that it was totally evil. It was death. And I just prayed in Jesus' name, please, Lord, if it's your will, take this away. If it is your will for me to go home, let me go home. And obviously it was not his will for me to go home. It was his will for me to survive, because the most beautiful crystalline blue light shone up behind my head. I could see the brightness of it. I could see that crystal blue color. It was just so beautiful. And that light shone so brightly. And it brought such peace. And it just pushed that darkness out of my room, down the hallway. And now, taking into account, I told you I'm like in a dream state here. It's, you're basically in a state where you're experiencing all this. But it pushed that darkness completely down that hallway. And I just knew in my heart it was pushing it out of every hallway, out of that hospital completely. And I was right on that. It pushed it out. Now, what I did not know is that at the time I was going through this, he was placing hands on the walls of the hospital praying in God's name for people to be healed, for me to be healed. And all of this together, God was working. He was working miracles that night. Well, that next morning, Dr. Boren, who works with Dr. D in his office, and don't get me wrong, Dr. Boren is a wonderful doctor. I love him. But he came into my room. Now, before I had this going on, or it might have been right after, I'm fuzzy. It was after, because it was after the darkness had left. I had fallen asleep. I woke up a little bit that Thursday night, and Piggy had come into the room. And he was carrying a brownie and a glass of lemonade, and my stomach started rolling. First time my stomach had rolled in all that time. I was hungry, and he said, I kind of licked my finger, and I reached up and I rubbed it across that brownie and tasted it. I said, that's good. Still, but good. So I reached up and I broke off a piece of brownie and I ate it. I said, yeah, I said, it's still. I said, that's good. I ate a little over half of his brownie, drank half of his lemonade, and I kept it down. And I told the doctor about it the next day. I told him, he asked me how I was feeling. I said, well, so I must be doing pretty good. I said, I ate half a brownie last night and drank half a lemonade. Told him about it. He said, did you keep it down? I said, yeah, I kept it down. He said, all right. He said, let's take this tube out. And so he took the NG tube out. And you're talking about burning. Now, if y'all have never had an NG tube, all I can say is I feel for you if you have to get one. But he took it out and he told me, he said, all right. He said, I'm going to order you breakfast. Eat your breakfast. If you can keep it down, fine. So you'll have your lunch. And if you can keep all that down, said you can go home this afternoon. I'm like, okay. Well, I ate my breakfast and I kept it down. And then just a few hours later, they brought in my lunch. And I ate part of it and kept it down. The rest of it, it was too spicy for one, but it was also really nasty. It was so nasty even Piggy couldn't eat it. But I did get to go home that day, late that afternoon. And what we found out later was that there were other people getting to go home as well. Pretty much the whole hospital got cleared out that day. But after I got home, about a week later, went to the doctor. We got set up for my chemo and my radiation. And went through all of that. And I tell you what, I'll tell you about the chemo and radiation later. But that's how I found out I had cancer. That's where it turned out. And that was just some of the things that's happened. And so that's a little bit about me. And a little bit about my faith. And if that doesn't tell you why I have faith, then I guess I'll just have to go into a little more detail later on. But thank you for watching. Have a great day. Bye, y'all.